Antibiotic resistance is rapidly emerging globally, posing a threat to the effectiveness of antibiotics, which have revolutionized medicine and saved millions of deaths. The epidemic is linked to overuse, inappropriate prescribing, extensive agricultural use, and the pharmaceutical industry's inability to discover new drugs due to difficult regulatory requirements and diminished incentives from finance. The CDC has identified numerous bacteria posing urgent, severe, and alarming concerns, causing significant clinical and economic strain on patients, families, and the American healthcare system. Coordinated efforts are needed to implement new policies, redouble research efforts, and explore crisis management strategies. Antibiotic resistance and its impact. Antibiotic resistance, a significant clinical issue since the 1940s, has led to the development of novel beta-lactam antibiotics and the first instance of methicillin-resistant Staphylococcus aureus, MRSA, in the US and UK in 1968 and 1962, respectively. Vancomycin was first used in 1972 to treat methicillin resistance in coagulase-negative Staphylococci and S. aureus. The pharmaceutical industry launched new antibiotics in the late 1960s and early 1980s to address antibiotic resistance, but the supply of new medications declined, resurfacing as a hazard in 2015. Antibiotic resistance is a global issue affecting individuals and public health, affecting various regions and not just a single area. Despite antibiotics' vital role in treating bacterial illnesses, excessive use has led to the rise of resistant microorganisms, making infections more difficult to cure and increasing the risk of serious disease or mortality. This affects individuals globally, affecting both developed and poor nations, and has ramifications on healthcare systems, economies, and global security. Antibiotic resistance, a global emergency affecting individuals from diverse backgrounds and geographical locations, is a significant threat due to the global interconnectedness of our planet. The World Health Organization, WHO, and other global organizations recognize this as a significant threat and emphasize the need for global collaboration to combat it and ensure the continued efficacy of antibiotics in healthcare. Only take an antibiotic when it is necessary. Never treat a virus with antibiotics. It is not recommended to save antibiotics for subsequent use. Antibiotics must be taken precisely as directed by a doctor. Never skip a dosage. It is important to finish the antibiotics even if you start feeling better during the treatment. Antibiotics prescribed for someone else should never be taken by you. Maintain proper personal hygiene. To prevent antibiotic-resistant germs, use tissue to blow your nose, cover mouth and nose, and wash hands frequently. Stay home, if unwell, to avoid spreading infections. Tidy spaces with lots of activity uses regularly clean, frequently touched areas like keyboards, remote controls, light switches, and doorknobs using basic disinfection wipes or sprays to prevent germ spread. For healthcare providers, prescribing antibiotics only when necessary. Timing the drug's administration as soon as possible to target the particular bacteria in concern, limiting the length of the time prescription for the medicine.